Hi, good afternoon. Welcome to the Marketplace. Coming up, the Ghana Mine Workers Union petitions management of BCM Ghana Limited demanding the immediate payment of end-of-contract benefits for over 700 members and former employees.
And so today we are gathered here to demonstrate to BCM that it has between today and Friday to pay us our money.
Also coming up, domestic tourism spending reaches 6.59 billion cedis in 2023.
Spending by domestic visitors amounted to 6.6 billion Ghana cedis in 2023. Of this amount, domestic same-day visitors spent 1.8 billion Ghana cedis, representing 88%.
Plus, pressure on the city may be easing as some commercial banks forecast a significant slowdown in depreciation by next week. My name is Darryl Kwao. Details coming up. And thanks for staying with us. First up, the Ghana Mine Workers Union has petitioned management of BCM Ghana Limited demanding the immediate payment of end-of-contract benefits for over 700 members and former employees. The contracts were terminated over 10 months ago, leaving the workers without their rightful benefits. Speaking to Joy Business, General Secretary of the Ghana Mine Workers Union, Mumin Abdugbana, said the union has been in talks with BCM Ghana Limited, but the company has failed to meet its obligations.
Money, the redundancy, the end of contract benefit is our sweat, is our blood. We work for it, and for that matter, every penny must be paid to us. So and so today we are gathered here to demonstrate to BCM that it has between today and Friday to pay us our money. Management of BCM, if you are listening, notice is served and notice is hereby served that between today, Tuesday, and Friday, we expect our end of contract benefit to be paid. I repeat, between today, Tuesday, and Friday, we expect our end of contract benefit to be paid to us. We are not begging for our severance package. It is a demand, it's a legitimate right.
Now, spending by Ghanaians traveling within the country reached 6.59 billion Ghana cedis in 2023, buoyed by a strong same-day and overnight trips that supported transport operators, accommodation providers, and local businesses, according to the domestic and outbound tourism survey released by the Ghana Statistical Service. Now, Dr. Al-Hassan Idrisu, Chief Government Statistician, revealed this at a press conference a while ago.
Total spending by domestic visitors amounted to 6.6 billion Ghana cedis in 2023. Of this amount, domestic same-day visitors spent 1.8 billion Ghana cedis, representing 88% of spending occurring, with 88% of spending occurring during the trips and the highest spending occurring in Q1. Overnight visitors generated 4.8 billion Ghana cedis, with about 80% spent during the trips. And we had 19% of the overnight trips actually being made before the trip, and then the rest of the 1% being made post-trip. For same-day visits, spending on self-arranged tours was about 1.5 billion Ghana cedis, accounting for the largest share of on-trip expenditure, averaging more than 95% per quarter. 95% per quarter. On-trip spending on self-arranged tour for overnight visits amounted to 3.7 billion Ghana cedis and accounted for the largest share of on-trip expenditure, averaging 97% each quarter. Now, for same-day visits, on-trip expenditure was highest in Greater Accra. In fact, about 431.5 million Ghana cedis across all quarters, while Savannah posted the least. In fact, Savannah NOT posted the least, about 2.1 million Ghana cedis, revealing regional disparities in tourism-related spending. Overnight trips, on the other hand, we saw the highest trips taking place in Greater Accra region across all the quarters, and this averaged about 183.3 million Ghana cedis. And here we have the Northeast actually recording the lowest, averaging 8.03 million Ghana cedis. For same-day trips, per capita spending, which is spending per visitor, was highest in Western region. We registered a per capita spending of 678.37 Ghana cedis, and it was lowest in the Northern region with a per capita spending of 135.94 Ghana cedis.
Now, there are signs of pressure on the cedi may be easing as some commercial banks forecast a significant slowdown in depreciation by next week. Yes, more.
These commercial banks, in their outlook to investors, argue that since most businesses will be breaking or winding up for the year by that time, that is expected to impact positively on the fortunes of the local currency going forward. Now, this because demand for foreign exchange is expected to drop significantly during that period. That should also go a long way to bring some relief to the Ghana cedi. Some of these commercial banks are basing their projection on the current strong dollar reserves of the central bank, which should send some strong signals to the investor community that the Bank of Ghana is in a strong position to support the Ghana cedi when it matters.
All right, you're watching The Marketplace. We are taking a short break. When we come back, we have a discussion for the exchange on Ghana's health budget for 2026, why some groups think that it is still falling short of financing commitments. Don't go anywhere. Hi, welcome back to the marketplace and to the exchange. Ghana's health budget for 2026 has gone up, but policy analysts say it still falls short of what is needed to deliver quality health care for all. To help us unpack what the numbers really mean for the ordinary Ghanaian, we are joined on Zoom by Emmanuel Opuni, who is Executive Director of the Center for Health Policy and Development Africa for the exchange. Good afternoon to you. Happy to have you on the marketplace. Now, the government says the 2026 health budget has increased by 23% on the surface. That sounds impressive. From your analysis, why do you say Ghana is still falling short of its health financial commitments?
Thank you very much, Darrell. Thank you for having me here. Yes, we must commend the government for that increase. It is commendable. But if you compare with our regional and global commitments, that's where we fall short. For example, we are committed to the Abuja Regional Abuja Declaration, which is supposed to be about 15% of the total budget. But even if we add National Health Insurance Levy, we are around 10%. So we are 5% away from the Abuja Declaration of 15% of total budget. Also, we are committed to the global benchmark of 5% of GDP proposed by the World Health Organization. Currently, our health budget as compared to the GDP is about 2%. But we need 5% to be able to reach the benchmark. And certainly, there are critical needs all over the country that needs funding to be able to solve. For example, there is only one cardiothoracic surgery center in Ghana, which is in Accra. And we all witnessed the death of a medical officer who was practicing in Kumasi, and he wanted to come to Accra to have the surgery in Accra, and he died before he reached the hospital. So there are a lot of needs around the country that if we are able to increase our funding for the health, we'll be able to solve.
So nearly half of the health budget is spent on compensation while goods and services and capital investment remain relatively low. What risks does this spending pattern pose for healthcare delivery, especially at the primary care level?
Yeah, thank you very much. Over the years, if you look at Ghana's budget we have analyzed from 2015, we realized that salaries and compensations are going higher and higher. And that is not bad in itself. But when governments have pressure, they use the budgets for capital expenditure and goods and services to pay salaries. And so when they do that, then it affects capital goods, it affects goods and services. So health workers may be there, but they don't even have the equipment, the materials they need to be able to serve our people. So it is imperative for us to increase the health budget generally, so we can pay the health workers and also have funding for capital expenditure and goods and services, so that operations can go on very well for Ghanaians to achieve the universal health coverage and the Sustainable Development Goal 3.
Yeah, and your analysis also shows a growing reliance on internally generated funds, including user fees. How could this affect vulnerable households and Ghana's goal of universal health coverage?
Okay, internally generated fund is not bad in itself, it's good, but a component of it is user fees. That's say people go to the hospitals and they are expected to pay some fees to be able to get the services. And a lot of our people who are in the lower tier of income suffer, because when they pay such fees, it affects, for example, their food, the funding on food, the money they use on food. And Bar Abeka and his friends have done some research in that area that indicated that about 60% of people who go to hospital suffer what we call catastrophic expenditure. That means that they pay the hospital fees, they pay the fees there, and they are not able to buy food, for example, or it affects the kind of food they eat. And that has also got health dimension. So our advice is that Ghana Health Service and the Ministry of Health try to analyze that very well. So they increase other components of the internally generated funds for the hospitals to get money to run them. But we should find a way of also cushioning the poor so that the poor will not suffer too much.
And it also appears mental health, disease prevention, and digital health are underfunded in the 2026 budget. What are the long-term consequences if these areas continue to receive limited attention?
Yes, thank you. There are long-term effects. For example, mental health prevalence is going up. The number of cases that are happening, not only in Ghana, all over the world, but for some, now we are considering Ghana. So the cases are going up. And we know that if somebody has mental health, apart from the fact that he himself is not productive, he will also need somebody else to take care of him. And so mental health is one of the most expensive sicknesses. So if mental health is allowed to go on without prevention and some of those things, it will affect productivity so much. And also disease prevention in general. If we don't prevent diseases, for example, NCDs, by 1990, there was the number of people who died from non-communicable disease were only 28%. And the recent research says that 45% of deaths are attributed to non-communicable diseases. So if you look at the difference, if we allow this trend to go on, you can realize that a time will come that majority of our people will be affected by non-communicable diseases, and that could affect productivity generally, and it will affect Ghana's economy and all that, to affect families, to affect the nation, affects everybody. So it is imperative that we find strategies to prevent such things, and also digital health. Technology is very, very important, and it is running very fast. It has so many advantages, for example, efficiency and effectiveness in diagnosis and cure. So if it is underfunded, we will get behind. The world is going forward. The world is going far forward. So if we don't do much about it, for example, we are only spending 10 million cedis on e-health in 2026. So if we don't catch up, Ghana will be behind, and we would spend far more money in medicines and other things, which may not even do the work for us.
All right, let's look ahead as we conclude. What are the top or three policy actions that you think the government should undertake if we are to realistically achieve universal health coverage and SDG 3?
Okay, thank you very much. Our first proposal is that we should have a national preventive health fund with emphasis on NCDs and some infectious diseases and disease surveillance and things like that. Because if we allow this trend to go on, there will be more people, there will be more sick people, and this will affect productivity. So it is very, very necessary that we have a national health preventive fund to be able to fund health promotion, policies, and research, which can help us prevent diseases. And then the next thing that we want to emphasize is increase of capital expenditure, especially in the rural areas. Because if you look at ISE's, Institute of Statistical, Social and Economic Research report in 2022, April report in 2022, they said that 73% of our rural areas do not have hospital in 5 kilometers.
Right.
Which is very, very serious. So we should increase the capital expenditure, build more hospitals, more cheap compounds and things like that, primary health care in our rural areas, so that the gap can be closed.
Thank you so much. Appreciate it. Emmanuel Puni, Executive Director of the Center for Health Policy and Development Africa. Appreciate your time on the exchange. And that's the marketplace, everybody. Thanks for watching. There is more news on our website, myjoyonline.com/business. My name is Darryl Kwao. Thanks for watching. We will be back same time tomorrow.